So what happens when the SA node fires? When the SA node fires, we get the PQRST, the ECG tracings. So what do you see in an ECG tracing? The rate, rhythm, the amplitude or the height, and the shape of the tracing, PQRST. So the rate, how do you calculate the rate? There are two methods for calculating the rate: the regular rate and the irregular rate. There are two different types. So the regular rate you can calculate by calculating the distance between the two R's. The rhythm is when the RR distance is at an equidistance. Then it's a regular rhythm. And the distance between the two R here you see is 1, 2, 3, 4 boxes. And each of these boxes is 0.2 seconds. So if you divide number 300 by these 4, that gives a heart rate of 75. So if this RR distance is reduced to 3 box, 2 box or 1 box, so what will be the rate? Let's see. If the RR distance goes down to the 1 box, then the rate is 300. 300 divided by 1, 300. If the RR distance is 2 boxes, then the rate is 150. If the RR distance is 3 boxes, the rate is 100. And if the RR distance is 6 boxes, the rate is 55. 350, sorry. So the 300 divided by 6, the rate becomes 50. So how do you calculate the rate by this duration? So what is the duration? How do you calculate the duration on ECG strip? Because each of these boxes are 0.2 seconds. This is one big square, the duration of which is 1 second from this point to the end here. And this square contains 5 square in it. So that if you divide this 5, so the duration for this medium size square will be 0.2 seconds. And each of these 5 squares have 5 smallest square. If you divide this 0.2 with 5, then the answer is 0.04 second. This is the duration of the smallest squares. 0.04 seconds. So the smallest square duration is 0.04 seconds, and the medium sized square is 0.2 seconds, and one big square that contains 5 0.2 second square is 1 second in duration. So the height of the smallest square is 0.1 millivolt, the amplitude or height that gives the voltage. So the one medium square has 5 of these smallest squares, so it is 0.5 millivolt. So 2 of the medium square makes 1 millivolt. From here to this point, it's 1 millivolt that contains 10 smallest square. So how do you calculate irregular heart rate? In irregular heart rate, you take 10-second strip. So calculating the irregular heart rate, you take a 10-second strip which contains 10 big square. Count the number of R's in a 10-second strip and multiply that with the 6. That gives you the heart rate. In this strip, there are 14 R in 10 seconds times 6. That gives you a heart rate of 84. And the other method is that you take 6-second stage. In 6 seconds, you count the number of R and multiply it with 10. That gives you the heart rate. So in 6 seconds here, it can then more than 8 R. So that gives you the heart rate. See, here is a 6-second strip. And in this strip, we have 1, 2, 3, 4, 5, 6 R. So 10 times 6, the heart rate is 60 beats per minute. Another method to calculate the fast heart rate is to divide 1500 by the number of smallest boxes between the QRS. That will give you a fast heart rate. So what happens if the SA node, what happens in the SA node? There may be that SA node may not fire, does not fire, no depolarization, or there may be a tachycardia, start firing at a faster rate, or there may be a bradycardia. So when the SA node depolarizes and it fires, the PQRST complex comes, that is known as sinus rhythm. Okay, if the SA node does not fire, what will happen? The impulse from the SA node goes to 2 points. It directly stimulates the atria, which gives you the P wave. And then after a delay in an AV node, it goes to the ventricles to give QRS complex. So if the SA node does not fire, there will be a drop beat. So this is a sinus rhythm. Compare it with this ECG at the lower one. So there is no P wave. What's the difference between them is that there is no P wave. So if the SA node is knocked down, there should be no QRS complex, but here we see a QRS complex. Why? Because when the SA node is knocked down, the AV node takes over the charge and gives the QRS complex. So what's the difference and that is known as nodal rhythm or the junctional rhythm. So what is the difference between the sinus rhythm and the nodal rhythm? That there is no P wave and the QRS complex is contracted, and also the firing rate of the AV node is 40 to 60. We'll deal the AV node later on. Right now we are doing the SA node. The SA node dysfunction. Any abnormality in the function of the SA node is sick sinus syndrome. It may be a sinus pause, arrest, arrhythmia, exit block, tachycardia, sinus tachycardia, sinus bradycardia, or sinus tachybradyarrhythmia. In sinus arrhythmia, the rhythm is irregular, number one, and number two, the QRS complex is less than 0.12 seconds. So in sinus arrhythmia, the rhythm is irregular and a QRS complex is less than 0.12 seconds. When there is a sick sinus syndrome or sinus arrest, there is a pause. See that on this ECG on the left, the rate is normal, then there is a pause, the sick sinus syndrome, and then there is tachycardia. Similarly, in the lower one, the rate is normal, and then there is a pause, and then high rate. Then the SA node exit blocks, the first degree exit block, there is prolongation of conduction from the SA node. The SA node impulse is merely slowed, but the ECG is normal in that case. There is a problem in the SA node impulse to get out of the perinodal tissue into the surrounding atrial tissues. This cannot be recorded because the external leads do not record the SA node electrical activity, so the ECG is normal. The second degree SA node block, the two types, type 1 and type 2. In a type 1, there is a progressive shortening of the PP interval followed by a pause. And what happens in type 2? There is no shortening in the PP interval, but there is a sudden pause. And in type 3, there is no P wave visible. At what age the SA node dysfunction is common? The SA node dysfunction is more common in the 5th and 6th decade and is usually asymptomatic. And what age the AV node block occurs? The AV node block is more common in young patients. And why is it due to? It's due to high vagal tone as occur in athletes. So this SA node dysfunction is usually asymptomatic and becomes evident on ECG. What are the clinical features of the SA node dysfunction? Hypotension, syncope, and lightheadedness. What is the cause of sick sinus syndrome? There are increased fibrous tissue and the sinus pause is of more than 3 seconds. Why? Because usually the athletes have a sinus pause of up to 3 seconds. What are the causes of sinus node dysfunction? Two causes, extrinsic and intrinsic. Amongst the extrinsic causes are the drugs, antiarrhythmic, the class 1 and 2, beta blockers, calcium channel blocker, and digoxin. The drugs used in psychiatric patients, phenothiazine, amitriptyline, lithium, and methadone. Which antacid causes sinus node dysfunction? Cimetidine. The other causes are hypoxia, hypothermia, and hypothyroidism. Increased vagal tone also causes sinus node dysfunction. Important to remember is the increase in intracranial pressure and also endotracheal tube suction. They cause sinus node dysfunction. So what is the cause of intrinsic defect? There is fibrosis and degenerative changes in the SA node, increased vagal activity. Number 3, coronary artery disease, myocardial infarction. Which type of myocardial infarction causes SA node dysfunction? It is the inferior myocardial infarction. Then carditis, radiation therapy, myotonic dystrophy, and Friedreich ataxia.